tonight's topic is going to be on type 2 diabetes, right? And this session, we actually is only the part 1 of diabetic talk. This part 1 is basically focusing on the prevention. Basically, we are going to talk about the risk factor that's affecting type 2 diabetes itself. And next month, the part 2, we will touch on the type 2 diabetics complication, which is a more technical session, but it's equally important. All right, first, let's look at the prevalence of diabetes in the world. Right? And I think we are in the Asia-Pacific region, so let's look at the prevalence rate. Generally, according to the IDF reports itself, basically diabetic prevalence in the world is about 10% of the adult population. So Singapore, actually, the prevalence rate is about 11.4% in adults. So it's even higher than the world average itself. And you can see this map in here. Those are darker in color are the higher prevalence rate. And in Malaysia, particularly, you can see, right? China and India are actually on the high prevalence rate scale. Right. So if you look at the chart below itself, it indicates that basically in global area of the type 2 diabetics prevalence rate itself, you can see that the China and India are the two epicenter. So basically, Asia is actually one of the epicenter of type 2 diabetic. And to say that, type 2 diabetic is a condition that actually carries a lot of socio-economic burdens, health burdens. Okay, what are the types of diabetics? Let's start with this. Diabetic is a condition where the body does not properly process food for use as energy, right? So basically, there are two main types of diabetics. Type 1 diabetics are where the body does not produce a hormone called insulin. And insulin actually is a hormone that is responsible for our body's absorption of sugar into our body, all right? So, but this type 1 diabetics only account for about 10% of the diabetic population. The majority of the diabetic populations are actually belongs to the type 2 diabetic population, and this is account for 90%. Then we have less than 1% of it itself actually is a diabetic that's happened during pregnancy itself. So these are transitional diabetics itself. We will not go to discuss in that on this type of diabetic. Okay, what is the most common, the type 2 diabetics, which is the most common of the diabetics type itself? Type 2 diabetics also called adult onset diabetics, which is a chronic disease, right? Characterized by high blood sugar and insulin resistance. These two are actually clinical parameters that we use to determine whether that we are suffering from type 2 diabetics or not. Okay. So basically, I think just to explain briefly what are the pathophysiology of actually type 2 diabetics, what causes type 2 diabetics itself. Basically, glucose is actually food that we eat. When we absorb the glucose, the food will transform into glucose in the bloodstream. Okay, the glucose in the bloodstream will enter the body cell with the help of a hormone called insulin. Okay, so in a type 2 diabetics patient, all right, the body cell does not respond to the insulins. Which actually is a key for our cell to absorb glucose itself. And therefore, we actually consider that type 2 diabetic patients typically have characterized by insulin resistance, whereby the body does not respond well to the insulin function. All right. So this results in the sugar build-up in our bloodstream. And that's why that we can actually detect high blood sugar in our blood. Okay, how do we determine that whether you have diabetes or not? Okay, basically, it's through blood tests, right? The blood test actually is based on the blood glucose criteria. There are three modalities. Very common one are the fasting plasma glucose, right? The other one is actually the hemoglobin A1C, right? And the third one actually is the oral glucose tolerance test. Basically, if you look at it itself, the fasting plasma glucose and hemoglobin A1C are the more common modality used in the clinical setting itself, right? So there are different criteria for different what I call different glucose criteria in here. I will leave it to you all to actually interpret yourself, right? So basically, we can actually differentiate a person from whether he's a normal or whether he's suffering from pre-diabetic or he's suffering from diabetic, depending on the what they call the glucose criteria they set. Right. So take an example of hemoglobin A1C, right? So if your hemoglobin A1C reading is less than 5.7% or below, then you're considered non-diabetic or you consider normal. But if your HB1C, A1C is above 6.5%, then you actually consider as suffering from diabetic. Okay, what are the symptoms of type 2 diabetic itself? So these are what we call the common symptoms, right? Without you go and measure the blood sugar, but then normally some of the signs are quite common for those who suffer from diabetic, type 2 diabetic. Most frequent one is actually frequent urination. This is because your high blood sugar level in your blood itself, right, will cause it to have the body to try to excrete it and therefore leading to increased urine production. Similarly, the high blood sugar itself with the urination excretion itself, it will result in excessive thirst. So these two are because of high blood sugar in the blood that are resulting to your excessive thirst and frequent urination. Now, when your body cannot actually make use of the sugar in the bloodstream because of an insulin resistant problem itself, then your body will not have enough energy and therefore it leads to fatigue. So fatigue is one of the symptoms of people who suffer, common symptom, suffer from type 2 diabetic itself. Again, if your body cannot have enough energy, glucose for your energy, your body might respond with to the brain to say that I'm hungry, I need to take more food, and therefore you will have symptoms of increased hunger, right? So these two symptoms are as a result that the body cannot make use of the glucose for energy, right? Then the high blood sugar, glucose in your blood will damage actually your blood vessel. And in the case, if you damage your blood vessel in your eye, retina, you will cause a blur vision. So this is very often the microvascular complication of diabetic patient itself, where you suffer from the blood vessel damage on your retina. All right. Similarly, if you have a wound, right, because of the reduced blood flow to the affected area, because of blood vessel damage itself by the high blood sugar, and therefore you will have very commonly find that your healing of wound is very slow. So these are the result of blood vessel damage itself. So here are the very common, what they call symptoms of people who suffer from diabetic itself. There are some other common symptoms here. You can see from here that a picture here whereby there are black patches on the neck as well as on the armpit. These are some typical symptoms of actually insulin resistant or people who suffer from diabetic as well, right? So I will just share with you, it's not something that you can very well able to judge, but some of the symptoms are there. And if you are having this type of symptom, then it's good for you to go for a proper diagnosis and checkup. Okay, let's look at what are the risk factors that can affect us on a type 2 diabetic. First, demographic side is on the age, gender, race, and family history. I'll share with you some of the data shortly. Another one is actually on the health side, which is your body's obesity, your dyslipidemia, and hypertension condition, your health condition. Lifestyle, your physical inactivities, smoking, air pollution, alcohol drinking, sleep problem, and stress problem, right? Dietary side, your unhealthy diet, eating of processed meat and ultra-processed food itself also contribute to the increased risk of diabetic patient, right? Medical history like gestational diabetics and PCOS, polycyclic ovary syndrome, are common medical conditions that also have a high prevalence in diabetic condition. Or also medication like corticosteroid and proton pump inhibitor. Well, proton pump inhibitor basically is a common medication that is used for gastric reflux itself. Right? So these two medications also can contribute to the increased risk of type 2 diabetic itself. We will discuss some of this in further detail. Okay, so let's look at a non-modifier risk factor. These are risk factors that you cannot change. First, of course, as you get older, your chances of getting diabetes, suffering from diabetes is higher. So in this case, in the Singapore context itself, you can see that if you are above 50 years old, there's about the prevalence rate of diabetic patients is about 19%. So it probably is a bit higher now, because I think that the conditions as well as the population group in Singapore is rapidly aging as well. So basically, you have about 20% of the population, 20% chance of actually suffering from diabetic in here. And in terms of gender-wise, the male is more likely to suffer from diabetics compared with female, right? As well as in terms of ethnicity itself, the Indians and the Malays have a higher prevalence rate compared with the Chinese itself. Okay, family history. I just actually have a discussion with Rob earlier before the session itself. And in fact, I mentioned that one of the major non-modifier risk factor for diabetic patients actually is due to family history or genetic pass on. If you look at it in here, right, this is a chart showing the indication of the family history relationship with the type 2 diabetic patients itself. Malaysia have the highest what they call relative relative risk of family history related diabetic itself. That means that 85% of the diabetic patients are actually attributed to family history, right? Whereas Singapore actually account for the second highest genetic family history cause diabetic. 71% of the Singapore diabetes are actually attributed to family history itself. Now, these are actually a very challenging indication because if you look at it itself, which means that there's nothing much you can do to reduce the risk except that you just have to actually manage the diabetic conditions because it's due to the genetic factor itself. So I don't have information on Australia here. These are all Asian countries. But if you look at it itself, China actually account for about 46%. But China, as we indicated earlier in the first chart itself, is one of the epicenter for diabetes itself. So therefore, actually, a high proportion of Chinese population, their diabetic condition is not caused by the family history, but rather by the environmental or modifiable risk factor itself. Okay, so what are the other risk factors? Medical condition. Let's talk about pregnancy. Pregnancy accounts for less than 1% of diabetic patients itself, right? So we call it gestational diabetes itself, right? But in Singapore, the prevalence rate is quite high. So prevalence of gestational diabetic in Singapore is about 23 or 24% itself in 2021. So it's quite high itself. So the reason is because that during your what they call the pregnancy itself, the hormones placenta produce hormones that help the baby to develop. But these hormones can block the action of the mother's insulin, leading to the insulin resistance, which means that the bodies cannot actually properly make use of the insulin to absorb the sugar. Right? So therefore, actually, it leads to actually what we call the high sugar, blood sugar in the pregnant woman. Now, what are the complications for gestational diabetes itself? For the mother, the complication is that it can lead to hypertension and preeclampsia. Preeclampsia is a very high risk condition whereby there's a lot of complication for the baby and for the mother as well. Also, for the complication for the mother is actually increased risk of cessation delivery. At the same time, we have 2 to 4 times higher risk of developing type 2 diabetic later in life. Right? So this is the complication of gestational diabetes for the mother. For the baby itself, it will have a risk of excessive birth weight, preterm birth, right? Or having low blood sugar after birth, respiratory distress syndrome, and increased risk of type 2 diabetes later in life itself. So these are actually some of the complications that may be related to the baby. Okay, another medical condition that actually is a risk factor for type 2 diabetics is what we call PCOS. PCOS is actually a polycyclic ovary syndrome itself, right? It's a very common endocrine disorder in women during the reproductive age itself, right? So PCOS women have a 2 to 3 times higher risk of developing type 2 diabetes itself. You can see from here, this is typically the problem of a woman who are suffering from PCOS, where the ovary is actually polycystic itself, right? Now, I will here briefly just to share with people who are suffering from PCOS, what are the dietary options that they can take to also moderate the condition. Healthy diet and physical activities are the first line therapy, right? For people who suffer from PCOS. The maintenance of a healthy weight is highlighted as a key factor in achieving of a significant reduction of type 2 diabetic risk in women with PCOS. So one of the key thing is actually healthy weight. So I will discuss about a lot of things on how to maintain a healthy weight shortly on this session today. Another suitable supplementation for PCOS woman is actually probiotic. Here, I will just leave it for you to study, to have a reference for it. There's a study to show that probiotic is an effective and safe intervention for the PCOS patient. Also, another supplementation, which is garlic. Garlic also is beneficial in improving oxidative stress and weight loss for PCOS woman itself. So basically, there are supplements, and in the food itself, take a lot of garlic, you can help people with PCOS. Okay, let's look at the modifier risk factor. This is actually the key, because in diabetic prevention, what we want to do is look at those risk factors that you can control, all right? So in one of the latest study by British Medical Journal itself, right, they published this very, what they call authoritative reports. And this reports itself, I consider that it's much more credible and relevant in the context of our preventing strategy, because it's actually looking at those who are already suffering from pre-diabetic, and then see whether that they have progressed into the type 2 diabetic or not, with all these risk factors considered, all right? So they are very focused on actually the condition of progression from a pre-diabetic to diabetic, and therefore these are what they call the risk factor, or the result of the study itself. So you can see from here that I spread into 3 portions. One portion is a psychosocial factor. In this case, right, the odds ratio based on a reference of 1. 1 is actually normal, and that's 0. Any number higher than 1 is actually increase in risk. Any number that's lower than 1 is actually decrease in risk itself, right? So that's for you to interpret on this chart itself. You can see from here that actually the anxiety is one of the highest risk factor in the psychological factor that can actually increase the risk of diabetic itself, followed by depression, right? Anxiety have a 2.61 times higher risk than actually a person that doesn't have anxiety itself, right? Another one, actually, you look at it itself, is the obesity factor. You can see from here that high waist to hip ratio, particularly this is a new way of measuring obesity. In the past, we actually tend to use BMI, right? So I think that progressively over the years, we find that BMI are not a sensitive enough reference sort of parameter to be used to judge obesity. In fact, waist to hip ratio has become a very common and sensitive relevant parameter for us to judge whether you are obese or not. All right. So if you have a high waist to hip ratio, right, you have a very high chances of actually having type 2 diabetic itself. In fact, your odds ratio is 2.44 times the normal person itself, right? So if you have a high waist circumference, your odds ratio is 1.5, right? So these are the indication. Look at the lifestyle factor. What are the key lifestyle factors that can affect the diabetic patients? First is actually lack of physical activities. If you are having a sedative lifestyle, you have a 1.86 times higher risk of actually having type 2 diabetics compared with if you're having a moderate physical activities, you actually have a 76% reduction in risk itself. So there is a very big factor in here, and we will discuss shortly on how actually can we use a physical activity. You can see that if you don't exercise, your risk go up. But if you exercise, actually you can help to reduce the risk most dramatically. In fact, one of the highest risk reduction one is actually the physical activities. You look at it, you see all the green bar. These are all the positive risk factor reduction. Right. Of course, the diet also play an important part, right? So I did not give you the risk factor of having a bad diet. Okay. In fact, this study basically indicate what are the diet that can help to reduce your risk itself. You can see in here that the Mediterranean diet itself actually have a 67% reduction in the risk of type 2 diabetic itself. We will discuss about the dietetic regime subsequently as well. So, okay, now the first of let's look at the smoking and air pollution in terms of the modifier risk factor. In here, we know that smoking increases the risk of developing type 2 diabetic. How significant it is itself? Basically, current smokers have a 30% to 40% higher risk of diabetes, right? Okay, you can see from here, from the number of cigarettes per day and the relative risk itself, the number of cigarette smoking per day, if you go up, your risk, relative risk go up significantly. So obviously that the higher the number of cigarette you smoke per day, the higher the risk itself. Okay. Secondly, air pollution also is a very significant contributing factor now. Right. We have now determined that actually, especially the fine particle PM2.5, as well as the nitric oxide, nitrogen dioxide actually will cause increased risk in diabetic mortality as well. So in this case itself, we look at it itself. We are not talking about just the risk of diabetic. We are talking about mortality itself. You can see from here that PM2.5 particle concentration, as you go up, the actually mortality hazard ratio actually go up in a straight line. But whereas if it's nitric oxide itself, the mortality actually go up very sharply. So therefore, air pollution is a significant factor in terms of environmental factor that can contribute to diabetic itself. So in an environment where it's highly polluted, especially in an industrial area itself, you will find there's a high incidence of people suffering with diabetic type 2. Okay, now let's look at the food. This will be more interesting for everybody. All right. So we all know that the diabetic patients should careful about the food they take, and basically it's a sugar, right? So most people will talk about sugar drink. All right. But I think sugar is not the only food that actually increase your risk of diabetic itself. You can see from here, right, it is obvious that apart from sugar or the processed meat, the synthetic sugar or artificial sugar, and the red meat are also having also contributing to the high risk of type 2 diabetic itself, right? So therefore, a lot of people might think that, oh, I don't take sugar, but I can take artificial sweetener. Well, that's not the case. In fact, in the case of risk for type 2 diabetic, artificial sweetener have equally high risk of having type 2 diabetic itself. All right. So regardless of the type of sugar, whether it's raw sugar or artificial sweetener itself, they all contribute to higher risk itself, right? So in a sweetened drink itself, you can see the relative risk factor itself, right? As the sugar sweetened beverage increases, the risk go up in here. The red meat also same in the same curve. You can see the linear line. And the processed meat itself, basically, there's a steep increase and then progress on here. So therefore, processed meat itself actually is more sensitive for the risk itself. But both, nevertheless, processed meat, red meat, and sweetened drink, sweetened sugar are all bad for your diabetic patient. Okay, then what are the food that is helpful or beneficial for people who are suffering with diabetic itself? So in here, you can see the risk ratio is actually on less than 1, right? Which means that coffee have actually a 35% reduction in risk if you take coffee in a type 2 diabetic. It's one of the highest beverages that can help you to reduce your risk. So we talk about coffee a bit, next page anyway, right? Followed by the whole grain food. Olive oil also helpful. Low-fat dairy also helpful. Yogurt, milk, vegetable, and fruits itself. So therefore, these are all the healthy food. All right, you can see from here, based on the chart itself, you can see that the whole grain itself, the relative risk is actually dropped below 1 quite steeply, very far. You don't have to eat a lot. In fact, you will get the benefits. Similarly, the fruits as well. But the overdose of food itself, you can see that the risk will go up again slightly, but still below 1. All right. And here, vegetable, same thing. In fact, you just have to take about 200 to 400 grams of vegetable per day. You were able to have a significant risk reduction, about 10% reduction in risk itself. But refined grain, on the other hand, actually increase your risk of diabetic. You can see from this chart itself. So therefore, the healthy one are the what we call the whole grain, the fruits and vegetable. The refined grain is not healthy itself. Okay, let's look at coffee. We talk about coffee because coffee have quite a high what we call reduction in your diabetic risk itself. You can see from here that coffee consumption reduces the risk of type 2 diabetic. Over 1 cup of coffee consumption onwards itself, you can see the drop in your odds ratio is actually below 1. But of course, this chart have a bit, for people who are looking at the chart itself and know how to look at it, there is a slight increase in the half a cup. So basically, if you don't drink half a cup, so I will advise you that you will not talk about diabetic itself, don't drink half a cup of coffee a day. Please drink more than 1 cup a day, based on this chart, right? I'm not going to explain why, but I'm saying that, wow, drink more than 1 cup, but don't, of course, or don't drink excessively as well, right? So in here, one important thing is that actually, diabetic patients very often have chronic kidney disease, right? Because one of the common complications of diabetic patient in the later stage of diabetic patient is very often suffering from chronic kidney disease itself. And therefore, coffee consumption is significantly associated with a lower risk of decline in your EGFR, which is a kidney function, right? A glaucoma filtration rate in patients with type 2 diabetic. This EGFR is a measure of the kidney function. So you can see from here that if you're having 1 cup a day and more than 2 cups a day itself, your EGFR actually drop itself is actually getting less and less. But whereas if you do not drink coffee, actually the drop is quite significant. So therefore, basically what you're saying is that if you drink coffee, it helps to slow down your kidney function decline for diabetic patients. So it's beneficial not only that it reduces your risk, but also it's helpful for to slow down your kidney function decline for diabetic patients. Okay, now to talk about food, what type of food is good, what type of food is bad, but the reality is that actually the overall dietary regime is more important, right? So in here, basically, in a diabetic primary prevention, the first most important aspect of it is actually on the diet you take. That's the key, remember, key. So dietary approach is key to the diabetic remission. If you want to actually recover from a diabetic condition or reverse a diabetic condition, focus on the diet you take, all right? So in here, I show you the comparative effectiveness of dietary pattern based on diet that have high glycemic index. That means a very high sugar index. Glycemic index basically the diet that have a very high sugar content, carbohydrate content, sugar content. Your risk is high. That means that you increase your risk of diabetic. You know that already. But Meridian diet itself actually reduce your risk by 19%. A DASH diet, which is a form of Meridian diet, give additionally reduction in your sodium intake, which is a salt intake. DASH diet is more focused for people who are suffering from cardiovascular disease itself, but basically they are very similar in a context with Meridian diet, except that they do focus on the sodium reduction. So therefore, in comparison, DASH diet itself, the risk is a bit even higher, a 21% reduction in the risk itself. So these are actually a very important study, which means that what are the diets that are suitable for people who are suffering from diabetes itself? Well, at least there's two diets that is sustainable diet that is proven in use, all right? So let's look at the Meridian diet. The reason why I put a Meridian diet is because Meridian diet is the most sustainable, easy diet that we have. In fact, very often we call it our normal healthy diet. Most of our healthy diet have the very similar, what they call context, like a Meridian diet. What it means is that, okay, basically the Meridian diet emphasizes on the plant-based diet, all right, focus on unprocessed cereal, ligament, right, and vegetable and fruits, and focusing on moderate consumption of fish, dairy product, right, and mostly cheese and yogurt, right, and focus on the low amount of red meat consumption. So I mean, all of you were able to access to the internet as to what the Meridian diet be, but generally you can see that half of it is actually fruits and vegetables. what they call 1/4 of it is whole grains, and 1/4 of it is a protein and healthy protein. Basically, this is the basic, right? Now, what are the benefits of Meridian diet for type 2 diabetics itself? There's a study here, right? This study by published in British Medical Journal itself, right? In fact, last year, it's the last year study, very recent study itself. And it's a very credible study because it's a meta-analysis itself, show that the effect on type 2 diabetic patient on the glycemic control, on HbA1c, fasting glucose, their drop, relative drop, and weight loss, the BMI, the relative drop yourself. So I will just share with you this result. Basically, it just show that Meridian diet can be effective for glycemic control as well as for your weight loss as well. Right. Okay, another risk factor we talk about is physical activities or exercise. Now, physical activities is known, all right, to actually we just mentioned, in fact, based on the earlier chart I've shown, that actually high physical activities were associated with actually lower incidence of type 2 diabetic. It reduced the risk of itself. We know that, all right? So let's look at some of the, actually, how the risk reduction is. If you look at this itself, I give everybody a reference itself, because this chart is quite technical in the sense that they try to standardize the level of physical activities based on MET per hour per week. And in fact, the metabolic equivalent task per week index itself is here. Different types of exercise will have different index number. All right. So level mind about that. Right. What it shows here is that as your physical activities increases, that means your MET hour per week increases itself, right? Your relative risk of diabetic from 1 is dropping down very steeply itself. And I give you an example that if you are having a brisk walking for about 6 hours per week, right, you will have close to about more than 30% risk reduction in type 2 diabetic. Just an example of how exercise can help you reduce the risk. And in fact, exercise is one of the very effective way for diabetic patients. If there's anything itself, it's more effective than actually your diet control. So of course, if you combine the two, the effects are much more pronounced. Okay, now another chart I want to show you is how the physical activities reduce the risk of what we call the arterial fibrillation, which is actually the irregular heartbeats itself. Now, the irregular heartbeats is a major risk factor for heart attack. I want to know, and I can tell you that a diabetic patient very often suffer from the irregular heartbeat condition as one of the complications itself, right? So this chart shows that if you exercise, right, what is the reduction in the risk itself? So here, first of all, we use non-exerciser as a reference. If you are a new exerciser, your risk is dropped by 6%, right? If you are exercise dropout, your risk is dropped by 5%. Sorry, your risk is dropped by 4% for the new exerciser. Your exerciser dropout, you drop by 5%. But if you are an exercise maintainer, your risk is reduced by 9% in comparison with a persistent non-exerciser for the reduced risk of your heart, what we call heart fibrillation. Okay, now in here, right, how does it mean, what type of exercise is relevant to the context of what we are talking about? It's also the same. Just how I mentioned that actually the brisk walking of 6 hours per week itself, actually this exercise reference actually also coincide with the lowest risk factor in actually the drop in the arterial fibrillation. You can see from here that as you have hit close to 1,000 minutes per week or 6 hours per week itself, right? Then the hazard ratio actually drop to a level whereby we consider as the level, one of the lowest level, right? So therefore, exercise not only helps you in reducing the risk of type 2 diabetic, but also helps you to reduce the risk of heart attack. Okay, now combining physical activities and exercise, the effect is much more pronounced, and this is one of the very important take-home message for everybody. If there's anything that's going to be effective for a diabetic patient to gain remission, it is actually to combine the diet and physical activities intervention. So you look at it itself, how much is the relative risk reduction for people who are actually doing this diet and physical activity intervention. For general population, actually, they will benefit the most. Obesity, people who are obese also will benefit the most. These two category of people will actually have more than 50% reduction in type 2 diabetes risk itself. Right? You can see from here that even people who are insulin resistant, which is before the pre-diabetic condition, most of us will probably have some form of insulin resistance even before you hit the pre-diabetic itself. So you can see that if you combine your diet and physical activities, your risk of diabetic actually is cut down more than half itself, right? So people who are having high risk of cardiovascular disease, if you do this itself, your risk is actually reduced by 41%. If you are pre-diabetic, it cut down by 36%, right? If you are a diabetic patient, it still can reduce the risk by 35%. So, right. So this combination of diet and physical activity intervention is the cornerstone of diabetic prevention. Okay. So now let's look at obesity. Now, one of the major risk factor is obesity. How does obesity affect diabetic itself? You can see from here, right? If you are overweight, your risk of diabetic is actually 2.24 times. But if you are obese, which is actually more overweight than the BMI of over 30 to 35, right, your risk is actually go up to 4.56. And if you are severely obese itself, your risk goes very, very high. Right? In here, you can see from here that the women are actually more susceptible to the obesity risk than the men itself, which means that if a woman have a weight increase and a woman, obese woman, they are actually having higher risk of suffering from type 2 diabetes compared with the men in here. Okay, now why we want to talk about that is because the obesity actually is closely related to lipid disorder. In fact, lipid disorder is one of the primary cause of cardiovascular disease. It's a primary cause. And why it's so important is because that if you will notice that in the next session, we'll talk about complication. Majority of the diabetic death are caused by cardiovascular events. And why is it? It's because the diabetic patient have carry with it high prevalence of lipid disorder. Right? And therefore, preventing diabetic patient having complication, the focus is actually very often dealing with the lipid disorder of diabetic patient. So that is the reason behind why we are focusing on the lipid disorder. Now, how prevalent is lipid disorder with associated with obesity? If you are obese, right? If you look at it itself, this chart shows that almost you have actually from 75% to 80% chances of in fact, the prevalence rate of having lipid disorder are more than 75%. Right? As long as you are obese, your chances of having suffering from lipid disorder is so high. It's so high. And if you look at it itself in here, right? The male and female gender as well as the BMI, as the BMI increase, right? Of course, the male will have a higher incidence of risk of lipid disorder compared with female. But then, to me, relatively both are the same. If you are obese, your risk go up proportionally in here. Now, it's very important. I want to mention that is because that in a clinical context, when you say that, okay, now how I want to prevent diabetic, I'm not diabetic yet, but I want to prevent it happen. One of the parameters you are focusing on will be on your lipid disorder condition. If you are suffering from lipid disorder, but you are still not under the diabetic, suffering from diabetic criteria, right? Then the focus of prevention is actually to normalize your lipid parameter. Okay, so what are the risk factors that are associated with obesity? Let's look at it. Since we're talking about obesity, have close association with actually the diabetic risk itself, right? So what causes obesity? Actually, overeating and poor diet, one of them, we all know. Sedative lifestyle, another one we know, right? Also family history. In fact, there's a lot of obesity due to family history, a gene, right? So you carry on in the gene. Your family that's actually obese does have obesity history itself, right? Medical condition like hypothyroidism can actually contribute to weight gain and obesity. Medication like antidepressant and steroid also. So those who are constantly on steroid and antidepressant will have a tendency that they'll find that they themselves will be overweight or suffer from obesity. This is due to the medication side effect. Okay, now we also talk about how to reduce the obesity, how to cut down if you are overweight. Like the first line of approach to cut down weight actually is exercise. No secret about that. I think everybody knows. But how to have an effective exercise? So the effective exercise based on two criteria. One is the length of your exercise, the duration of the exercise. Second is the intensity of your exercise. Okay. So in here, I just share with you, right? If you are going for weight loss, right, you want to actually run having an aerobic exercise, which is having a duration of at least 150 to 300 minutes per week. So this is the duration that's for you to cut down your weight. Okay. Now, what is the intensity? Right? That means when you exercise, what is your heart rate, maximum heart rate you should achieve? What is the zone that you actually will maintain your heart rate itself? Right? For target heart rate zone is 65 to 85%. Right? So if you want to build up your heart, but if you want just to fat burning itself, you can actually maintain it 50% to 65% of your heart rate. Right? So the heart rate is based on the maximum heart rate, of course, we are talking about. So you know how to calculate a maximum heart rate. I've talked about it earlier, but if you not, let me know. I'll teach you how to calculate a maximum heart rate. So, okay. Now, this is very important. It takes me quite a fair bit of time to actually summarize it. And there's a reason why that I want you to download my PDF soft copy is because this is where you actually go back for a reference, right? I will very quickly just highlight what are the things. In here, you can see that there is 4 dietary strategy for obesity management. These are the 4 proven dietary program that it works for people who want to have weight loss itself. All right. In here itself, we have one is high protein and fiber rich, right? So as far as concerned, we have another one is Mediterranean. And I combine Mediterranean and DASH diet is because, as I mentioned before, DASH diet is very similar to Mediterranean, except that DASH diet with some sodium control. That means that the salt you take is being controlled. So they are in the same category of actually food content, the proportion. Then we have what we call another modality for dietary strategy is actually intermittent fasting. We'll talk about it. It's very interesting program itself, and I think some of you might be familiar with intermittent fasting. And then we have another one which is called ketogenic diet. This is also some of the very common one that a lot of people are practicing. We call it low-carb ketogenic diet itself. Now, this table summarizes the pros and cons of it itself. I give you some highlight, right? First of all, I think we look at the one that is time to remission. That means how effective one. So there are 2 that's very effective. That means in weeks to months, you see result one. One is actually the intermittent fasting. The other one is the low-carb ketogenic diet itself, right? So how effective for weight loss? Actually, intermittent fasting, the effectiveness is moderate to high, right? But low-carb ketogenic actually is very high. So then the answer is, wow, this should be the choice of action, right? But I'll wait for a minute. Don't jump into conclusion. But I want to also highlight that if you look at it itself, look at the side effect, right? Look at the contraindication. Then you will turn out that the low-carb ketogenic diet itself, if you are suffering from kidney disease, you are suffering from liver disease, you are in pregnancy, you are not to take this regime. This is not advisable for you. Similarly, for intermittent fasting itself, right? The contraindication is hypoglycemia, eating disorder, and pregnancy. While hypoglycemia is one of the complications of diabetic patient. And therefore, it means that if you are diabetic, you are not suitable to use intermittent fasting to cut down your weight. Right? So these are the problem with these 2 rapid, what we call fast-acting diet regime. On the other hand, the only diet that is absolutely safe for you in this moment actually is the Mediterranean and DASH diet. So that is actually the key advantage of this itself. Unfortunately, the DASH diet or Mediterranean diet itself, the time to remission are very slow. You have to actually have long-term adherence to it itself in order to see result. All right. So this is a snapshot of comparison, right? Obviously that there are pros and cons, and let's talk about the 3 diet itself. Okay, intermittent fasting. Right? We have talked about Mediterranean already. I won't talk about it further. I'm going to talk about intermittent fasting. What is intermittent fasting? First of all, it's been known that intermittent fasting outperform calorie cutting. That means that if you want to have a diet that's using calorie cutting, restriction of your calorie intake, your energy intake itself, it's better for you to actually use fasting, intermittent fasting than that itself. And it's less suffering, in fact. Now, what is intermittent fasting? For example, there's form of intermittent fasting called 4-3 intermittent fasting, which means that for 3 days, right? 3 days in a week, right? You actually restrict your calorie intake, which means you probably take less than 1 meal or 1 meal. In 3 days in a week, you take 1 meal only, right? Then the 4 days in a week is normal for you. So this is what we call 4-3 intermittent fasting. This is an example of itself. Now, how effective is it itself? Right? Some of the results here. This is one of the results I show you. Right? First of all, what it actually says is that they produce modestly superior weight loss compared with daily calorie restriction in 12 months. So after 1 year, basically it shows that it's more effective than your calorie restriction. Just forget about it. More important actually is what's the result. 38% of fasting participants lost at least 10% of the body weight by the end of the year, compared with those who use calorie cutting with 16%. So therefore, basically, it's much more effective. It's not 100% going to guarantee able to be effective, but at least at 38%, showing a 10% reduction is quite good in compare. Now, as I say, what are the contraindications for what they call intermittent fasting? One is that hypoglycemia, right? People who are risk at hypoglycemia should not go into intermittent fasting. This means that it's not suitable for diabetic patient, but it's suitable for pre-diabetic patient. So, right? Those who have eating disorder are not suitable for this, and pregnancy are not suitable for this. Okay, ketogenic diet itself is also a very popular weight-cutting diet, right? Basically, the concept is that actually your carbs is only about restrict to 5 to 10%, your protein is 20 to 30%, and the rest of it is high level of fats. Now, these fats are the good fats, generally. What you saw here is quite a good fats. Now, what are the significant effects of ketogenic diet? First of all, actually, ketogenic has been proven in all these studies you can show here, right? That actually are quite effective on weight loss, loss of body weight itself. You also actually effective in lowering triglycerides, increasing your good cholesterol, and lowering your glycerated hemoglobin, which is basically lowering your blood glucose level itself, right? Now, so what are the contraindications for taking ketogenic diet itself, right? Basically, if you're suffering from kidney disease, liver disease, and pregnancy, you are not allowed to take on this style diet regime, right? In fact, ketogenic diet is most suitable for overweight or obese person. This is actually one of the most proven, most effective approach for people who are overweight and obese. But remember, if you're having kidney disease, liver disease, you should not go on a ketogenic diet. Okay, now let's look at how a type 2 diabetic disease progress. All right, so we call it natural history itself. Now, typically, right, the type 2 diabetic patient will start with actually weight gain, right? Then from the weight gain, progressively they will find that they are having what they call lipid disorder. That means that they have high cholesterol and so on. From there itself, it will progress to actually hypertension, right? Then you will reach a stage whereby we call pre-diabetics, where your what they call your diabetic your glucose criteria are actually slightly elevated, right? Then early diabetic, then you have the late diabetic. This is a typical progression of actually a diabetic patient disease. So in here, if you look at it itself, right, weight gain and lipid disorder are actually the precursor to a diabetic condition, right? And then followed by hypertension. So all these are actually factors that in the prevention side, we should address first. That means that if you are having weight gain, we should address the weight gain before you progress. And if you are having a lipid disorder, we should address the lipid disorder before it progress to hypertension and so on. Right. So these three are actually the key primary prevention target. Right. Whereas when you are already in pre-diabetic, early diabetic, and late diabetic, the target is no longer a prevention. The target is actually mitigation and reduction of a control. monitoring and control, management of it. Okay, now let's look at the lipid disorder. Right? How prevalent is it? You can see from here that diabetic lipid disorder is extremely common in, it affects about 60% of patients in here. So you can see from normal person compared with type diabetic patient, normally about 60% of it will have lipid disorder. And if you look at it, if your diabetic is not controlled, that means that you are uncontrolled diabetic patient, your your glucose parameters are not normal, even you take medication, it's not controlled, then your chances of suffering from lipid disorder are almost 93%. That means that there's a very high prevalence rate of people who do not have the diabetic condition under control. So this is actually the problem. The problem is that because of this high prevalence rate of lipid disorder in diabetic patient, uncontrolled diabetic patient, that is actually the leading risk factor for cardiovascular disease and cause of death for diabetic patient. Okay, so why we want to look at it a bit more detail is because that subsequently when you start to take omega-3 or you take some of the supplementation, then you must know which target you're looking at. So there are 3 targets in terms of lipid disorder. Basically, we look at bad cholesterol, the bad cholesterol, which is the LDL, right? Your good cholesterol, which is the HDL, and your triglyceride. So these 3 are the parameter for a lipid profile, all right? So in a typical diabetic patient, the problem is that the diabetic patient, when they have a lipid disorder, all 3 parameters are affected. That means that they suffer 3 lipid disorder parameter concurrently. So you can see from here that their good cholesterol are low, below the normal, right? The bad cholesterol are high, LDL, and the triglyceride are high. So all the parameter that's defining a lipid disorder for a diabetic patient, basically they hit all 3. And this is the most complicated part itself. Why? I'll explain to you. Right? You can see that what is the treatment for a lipid disorder. Currently, the treatment, if you were to go and see a doctor, right? Doctor will based on your total cholesterol and LDL and HDL. They will have a blood test and basically they will measure. Right? If you're healthy, right? Basically, the doctor will not say anything and basically we know that, okay, now stay on with your healthy lifestyle. Like, eat healthy food, right? Low sugar intake, high fiber intake, limit the alcohol, have regular exercise, quit smoking, manage stress. So these are the things. But if you are having a risk level, which means that your cholesterol level is between 200 to 239, or your good cholesterol level is below 59, right? And the LDL level, the bad cholesterol level is 100 and 159, then the doctor will maybe advise you that, hey, you have to really go and do an exercise. Keep yourself a very rigid physical exercise regime, and your diet must control your diet already. You must probably want to take a healthy diet, like so-called Mediterranean diet or low-carb diet. So these are intervention. That means that it requires you to take action already. It's not a wise anymore. But if you are having a high level of cholesterol level of very high triglyceride, very high bad cholesterol, and very low good cholesterol, then basically not only the lifestyle intervention is recommended, you will also have medication. So remember, when you are under this condition, right, lifestyle intervention is no longer suffice. You need to have medication to help, right? So don't be a hero that you think you can manage yourself, right? You need help and you need to take medication. Okay, what are the medications? So I will dispense with this one. This one is too technical, but then basically everyone must know that if you are having high risk and high cholesterol, right, you need to see a doctor and get medication. Now, to do that itself, there are already existing many types of medication that's been effective. Now, why I want to show this chart is just to highlight to you is that, you see, there are you need to recognize only 3 types of medication, because these 3 types of medication are each effective for each particular types of cholesterol, right? For instance, statin is very effective in lowering the bad cholesterol, only on that, right? Niacin is very effective in increasing the good cholesterol, right? And fibric acid or fibrates is effective in lowering the triglyceride. So you can see from there that all three parameters have different types of effective medicine that can be dealt with. Unfortunately, you see earlier, we mentioned that the characteristic of a diabetic patient is all three are affected, right? They have very high bad cholesterol, they have very low good cholesterol, they have very high triglyceride. So you probably have to take all three medication to work, right? It's not true. You need not have to take that. But it is actually where the complication is. So I want you to realize that, first of all, even in the medication side itself, they are effective medication. But then if you have a combination of effects itself, the combination of medication might take a toll on you on the side effect. All right. So fortunately, right, there are new generation drugs on board, and then you can see from here that some of the new generation board the nicotinic acid with statin. This is called Avico, right? And in fact, this is probably one of the most effective combination drugs that we have seen that actually are able to lower LDL, the bad cholesterol, and the triglyceride, and then increase the HDL, which is suitable for people who are typically suffering from our diabetic patient itself, right? So of course, there are some other combination drugs, right? Some of them are suitable for hypertension combination, right? Some of them are actually statin with absorption inhibitor for weight reduction. So these are examples for you, just for your reference. I'm not going to delve into it, but very important is that there are medication that's effective for each types of cholesterol problem. So do not think that you have to self-medicate. Really, you should seek medical attention if you are having a problem with a cholesterol level. Okay, now more interesting, more practical thing is actually what are the lipid lowering beverages? What drinks we can take to lower our cholesterol, right? So black tea is known to be a very effective one. I will talk about atomic black tea shortly, all right? So first of all, black tea and green tea also is effective. In fact, black tea is more effective than green tea in improving the lipid profile, all right? Coffee consumption also helps, but as we mentioned, that coffee consumption is able to reduce the risk of type 2 diabetic itself. So don't jump into it and keep on drinking a lot of coffee. Yeah? Remember, there is a limit, all right? So here I give you the limit, right? Up to 400 milligrams per day or equal to 1 to 4 cups per day of caffeine is a safe one. That's a safe range. That means that if you want to drink coffee, 1 to 4 cups, okay, never mind, it's okay. But there are also people should not drink coffee. So I want you to remember that while coffee is very good, it's beneficial for weight loss, beneficial for type 2 diabetic, there are people that should not drink coffee, or white coffee. Which are the type of people? Lung cancer patient, lymphoma patient, pregnancy loss patient, people suffering from rheumatoid arthritis, right? People suffering from urinary tract cancer, right? And also people who suffer from acute leukemia, which is very common in the childhood side. So these are the people who should not actually drink coffee. While we say that coffee is benefits, but coffee generally benefits for people who suffer from liver disease itself, right? And actually it's also benefits from people who are suffering from chronic kidney disease at a mild chronic kidney disease level. Okay, now what are the effective lipid-lowering nutraceutical? These are the non-drug nutraceutical that have proven effectiveness itself, right? So we know, first, the most foremost is actually the red yeast rice. Now, this is very common in TCM, right? Now, because basically red yeast rice contain the same chemical compound as statin, lovastatin. Actually, lovastatin is actually derived from red yeast rice extract, right? Which contain monocholine K. All right. Now, so just a word of caution. While red yeast rice is effective in lowering as effective as a drug reward statin in lowering the cholesterol. If you are a patient that's already on statin, you should not take red yeast rice supplement. Remember, I just want to put a caution on it. You are already on statin, you should not take red yeast rice supplement because they are the same. You overdose, right? Secondly, is that if you are on statin and it's not effective, you should not take red yeast rice to try to actually improve or potential the efficacy of the cholesterol treatment because it's not going to be effective by the same as well. They come from the same compound. So just a reference for everybody, okay? Another very popular and effective compound actually is berberine. Berberine is actually commonly used in TCM as a formulation for treating diabetic patient as well, right? So there's some study for you to reference. And in fact, it's proven that they have good efficacy and safety in treatment for people who have actually lipid disorder. All right, so you just go for I leave it for you to have your own reference. Another one is actually omega-3 fatty acid, which is what the main topic they're going to talk about shortly. All right, so actually the omega-3 fatty acid are from fish oil. It contains of two active ingredients, EPA and DHA. All right, then there's a vegetable form of omega-3 fatty acid. We call it alpha-linolic acid, or in short, we call it ALA. These are the vegetable form of omega-3, right? So it actually comes from oil of flaxseed, walnut, canola oil, soy, and chia, and so on, right? So these are the vegetable form of omega-3. So these two are equally effective as a lipid-lowering nutraceutical, right? We'll talk about it shortly. These two we'll talk about shortly because Atomy have both omega-3 product and ALA product as well, right? So then we have a spice that's actually also very effective for lowering your lipid profile, right? So garlic is one of the very effective, well-studied spices itself. So obviously, it doesn't hurt for you to actually add a lot of garlic in your dishes and eat. Of course, garlic also in the form of supplementation also available in the market. Okay, now probiotic as a nutraceutical for diabetic. Now, having said all that, right, there is one that is actually very safe and actually it doesn't hurt for you to try to take anyway. And in here, probiotic have a lot of, in fact, there's a lot of study on probiotic on its function. It's very widespread, right? Now we talk about probiotic also being effective for obesity, it's effective for lipid disorder, for glycemic control of diabetic patient and all that. I leave it to you to study. I will not go into detail, but basically diabetic is actually a good, useful, safe, effective nutraceutical for diabetic. But you're not going to give you an immediate action, but you should take it over time. It should help. It will help. Okay. Now we also talk about medical condition that contribute to the during a pregnancy, right? We call it a gestational diabetic itself. Now, probiotics are the most common and effective intervention for reducing the risk of gestational diabetic itself. So, for people who are suffering from gestational diabetics, probiotic is one of the most common and effective intervention option, right? Just for you know, and these are all the results and clinical study for your reference. Okay, now let's go straight into the lipid lowering nutraceutical of omega-3 fatty acid. Now I want to put it in because it's very important. Omega-3 fatty acid is a very common supplement that everybody takes. But put it in the right context. If you want to take this and want to make it effective, you have to learn how to take it well. So I will give you a summary. First of all, it's proven that actually even the American Heart Association and College of Cardiologists recommend you take omega-3 for patients with persistent, elevated, severe hypertriglycemia, which means that triglyceride, people who have high triglyceride level. Remember I said there's 3 parameters on lipid. One of them is high triglyceride. One is bad cholesterol, which is LDL. One is the good cholesterol, which is HDL. So in this case, omega-3 is for patients with a persistent high triglyceride, right? It's recommended for high triglyceride. So why? You can see from here, right? In here, there's a study show that for overweight patient, right, when you take omega-3, the triglyceride level drop very drastically, very straight line. So this is the reason why they recommend that you take omega-3 fatty acid for people with high triglyceride. Now, it will not lower your bad cholesterol and it will not increase your good cholesterol for people who are overweight. Remember, taking omega-3 does not help your bad cholesterol, does not help to improve your good cholesterol, right? You look at it. Now, on the other hand, if you are normal body weight, right, not obese, if you choose to take omega-3, right, it actually can help to increase your good cholesterol. You can see from here, right? But it's not going to help very much in reducing your triglyceride. It's not going to help very much in reducing your bad cholesterol. So there is a distinction between who should take and why you should, when you should take, whether your body condition, right? So if you are overweight, it's good for you to take, but it's only effective against your triglyceride. It's not going to be effective for LDL. Now remember, we say that diabetic patients suffer from all three parameters, right? That means that the LDL also go up, HDL also go down. So henceforth, if you take omega-3, DHA and EPA alone, it will not address the LDL problem and HDL problem. You only address your triglyceride problem. Okay? Now, having said that, right, I will leave the rest to talk about in the autonomy product shortly, right? But here is a summary of what today's lesson. For the primary prevention of type 2 diabetic, right? These are the strategies. First, reduce stress. Second, maintain healthy weight. Third, have regular physical activities. Number 4, eat healthily. Choose the right diet regime for you, suitable for you. Have adequate sleep. Quit smoking if you're smoking, right? And avoid alcohol or moderate in alcohol consumption, right? So these are the strategy to avoid type 2 diabetic. Okay? All right. Now, let's talk about Atomi's omega-3. So I will have Atomy have two products in there. One is RTG omega-3 and one is Atomy Asca E omega-3. I suppose RTG is the later version of it itself. Now, the serving size for RTG is 3 caps. Whereas Atomy Asca omega-3 is 2 soft gel. Right? Both will give you the same amount of EPA and DHA. The 3 cap will give you a 700 milligram of EPA and DHA, which account for 70%, right? Whereas the Asca omega-3 is 2 soft gel, big soft gel, which also will give you actually 700 milligram in 2 soft gel. So therefore, these are the same. They are the same actually in terms of dosage, right? So as far as concerned, the only difference between RTG and E omega-3 for me to advise you is RTG omega-3 is better absorption, right? While the concentration of the active ingredient are the same, right, in the dosage, on daily dosage, but RTG omega-3 will give you better absorption compared with Asca E omega-3. Okay. All right. Now, application-wise, I mentioned already, right? I will skip this chart whereby that remember omega-3 is only good for triglyceride level for obese, overweight people, and good for raising the HDL level for a normal weight person. Okay. Now, application, right? The dosage required for application itself, you will make your own judgment. But basically, we know that for cardiovascular disease, you can take up to 4 grams daily. Reduce symptom of depression, you can take up to 1 gram twice daily, right, which is 2 grams daily. Reduce risk of heart attack, you can take up to about 1.8 grams, which is actually 2 grams daily. And then have high level of LDL, cholesterol, or other fats in the blood, right, 2 grams twice daily. But as far as concerned, actually, this should be a correction, basically, that you should have a high level of triglyceride. So I want to make a correction in there. There should be a high level of triglyceride, not LDL itself, right? Now, okay. Now, one thing is just to remind that everyone that is that while the effective dosage itself, evidence from all the study say that you have to take medium to high dosage, which means that you probably have to take more than 2 grams per day for you to see effects on all this, for the treatment effects of all this heart disease, cardiovascular disease prevention itself. So you need to take, in this case, about 700 milligram times or 3 times a day. You will probably about 2 grams per day of equivalent dosage itself. Okay, precaution. People who have arrhythmia, which is irregular heartbeat, should not take, right? And then at the same time also, what is the maximum what I call grammage you should take for people who have no have a condition, have risk. So in this case, if you look at it itself, basically the US FDA recommend you should not take more than 3 grams per day, right? But I'll put it that way. If you look at the chart itself, basically, you should not take more than 5 grams because if you look at it itself, if you take more than 5 grams, your SBP, which is actually your blood pressure, the higher reading of the blood pressure will go up. In fact, after taking excessive of actually the omega-3. So therefore, you have to be careful that not only that excessive intake of omega-3 will cause a breathing risk, you also actually will cause increase in your blood pressure as well, right? Okay. Now, another one we talk about actually is the vegetable form of omega-3. We just mentioned just now is we call it alpha-linolenic acid, ALA. Well, just summarize, okay, Atomy have a product basically on this itself. Now, how do you compare the EPA and DHA and compare with ALA in terms of all the 3 parameters of your actually of your lipid parameter itself, right? So in terms of triglyceride itself, both EPA and DHA, the fish oil and the vegetable oil, or both actually have reduction in the triglyceride, but the fish oil are more effective, right? If you look at it itself. But for the bad cholesterol itself, right, the fish oil, in fact, does not decrease the bad cholesterol, you increase the bad cholesterol, whereas the vegetable oil, omega-3, does decrease the LDL cholesterol, right? So same thing for total cholesterol, which is actually LDL and combined, right, with HDL. So same thing, right? The total cholesterol, the fish oil increase your total cholesterol, whereas the vegetable omega-3 decrease the total cholesterol. Now, for the good cholesterol itself, the fish oil increase the good cholesterol, whereas the vegetable oil doesn't have any effects on it itself. So if you look at it itself, right, there's a pros and cons, right? But if you are having very high triglyceride level, then fish oil probably is preferred. But if you are having a problem with high triglyceride, also very high LDL, right, then you probably choose to take actually vegetable omega-3 is probably suffice. So you have to make a judgment as to depending on your lipid profile, lipid condition, disorder condition. This is my advice. Okay. So here, which are the product? In fact, the product that contain alpha-linolenic acid is actually in Atomy is actually the sea buckhorn seed oil, right? The sea buckhorn seed oil. So in here, the amount is actually 2 capsule intake equal to 100 milligram, which contain 800 milligram of actually alpha-linolenic acid and the other acid itself, right? So for the dosage, please based on the recommended daily amount you take it, right? But you can take higher based on the omega-3 dosage of 2 grams, up to 2 grams is okay. Because that is actually generally the same class of omega-3. So you can take up to about 2 grams per day, is still safe itself. Okay. All right. So now the last one we're going to talk about today is a bit long, but I'm going to talk about is because of this very often a neglected product, which is actually I personally I put it away. It's one of the very good product that a lot of people have neglected. Right now, I tell you why. The black tea, actually the pu'er tea, actually is one of the best natural anti-inflammation black tea. Right now, what are its action? actually is anti-hyperglycemic, which is basically good for diabetic patient. Anti-hyperlipidemic, which is good for people who have cholesterol problem. Antioxidant effect, which is for people who have inflammation problem, right? So these are the non-pharmaceutical action. Now, why is it that the atomic pool tea is actually significant? First of all, in all the black tea, it contain active ingredient called garlic acid, right? Which is a known powerful natural antioxidant. So we base on the active ingredient amount to determine its potency. All right. So for one pack of actually the atomic pool tea, which is 1 gram of extract. This is the extract. Atomic pool tea is not a normal tea leaf powder. This is a tea extract itself, right? So 1 gram of pool tea extract is contain 35 milligram of garlic acid. Whereas if you take 1 packet of your pool tea, normally it's about 0.7 gram of the tea leaf powder, right? So if 1 cup of it itself, you only contain about 1.2 milligram of garlic acid for a normal cup of pool tea. So 1 pack or 1 sachet of the atomic pool tea extract itself is equal to 34 cups of regular pool tea in terms of its garlic acid content itself. So it is a very high potency black tea extract drink, right? So you don't have to drink a lot. In fact, you drink 1 cup itself, 1 sachet itself is more than suffice to equal to you drink 34 cups of tea. So therefore, it actually can give you a high potency drink, right? And that's the value of it. So a lot of people don't understand, right? So drinking tea is okay, but you have to drink 34 cups of tea to get 1 packet. Do you drink 24 cups of tea to get the same effect? The answer is obviously no. All right, you don't drink 34 cups of tea, but I can drink 1 pack. I give you the strength of 34 cups of tea, right? So what are the application itself, right? In here, I have listed all the black teas recent study and their results. I'll leave it to you to read, right? But more important is that its application is anti-hyperglycemic, anti-hyperlipidemic, and anti-obesity, right? Now, is there a risk? Seen a lot of people might ask, hey, your black tea extract is so concentrated. So what happens if I overdose? Is there a risk? Well, one of the safety measure of it is that how many milligram you take without any adverse effect. So in this case, no observable adverse effect of the black tea extract is actually 800 milligram per kg of our body weight per day. So you can calculate, which means that if you are 70 kg, right? So your maximum limit for taking the black tea extract is 800 milligram times 70 times. So this is very high level. So therefore, if you drink your current pool tea, right, which is actually only have 35 milligram of garlic extract per pack itself, right? You would have to drink a lot in order to hit the safety level. So therefore, no risk, right? You can drink, but I will advise that you don't have to drink so many packs anyway. You drink 1 pack, in fact, the most 2 packs a day is more than suffice because it's already equal to 34 cups a day of drinking anyway. But it's very effective. And I tell you that the black tea is more effective than green tea in normalizing your lipid disorder problem. This is a study in here, right? So it's known that the black tea are more potent than the green tea. So please drink more black tea. In fact, if you want to cut it, there's no need to cut corner to do a lot of things. In fact, drinking tea regularly will help to cut down your body weight as well as the lipid disorder as well. Okay, that's my session today. I'll pass back to Pauline.